Hi everyone. Spoiler is in the title. That and the fact that I'm wearing this tank top with suspiciously low sleeves. I got top surgery. I've been sitting up for a little bit now, so my chest is probably swelled up again, but I'm just gonna give you the quick peek. So yeah, this is a month post-op. As you can see, yeah, I am having some swelling here. Um, but for the most part, I'm really happy with how my chest looks. Incision's really small. Um, I'm hoping that puckering on the scars will go down as the swelling goes down. And the nipples are definitely hanging in there and looking happy. So I'm a month out from surgery. I'm feeling pretty good. Touch wood, I haven't had any real complications or anything. Um, Surgery itself was pretty low hassle. As of really the first week after surgery, I haven't had any major problems. I'd say my energy levels have gone back to normal. I started going back to the gym the other day to do some like really light exercise. Um, and yeah, I'm feeling pretty good. I went out dancing last night and I am a little sore from that. But otherwise, yeah, I'm back-ish to my usual routine. I wanted to make this video in part because I did a slightly unusual thing with my surgery. I had surgery in France. I am American, but live in the UK. I've done most of my transition privately. So for hormones, which I've been on now for about 16 months, I went to a private clinic in London. When I started my transition medically, um, it was something that I'd been planning for a really long time, but I hadn't really been in a headspace to start accessing care. I did not go on the NHS waitlist for top surgery at like a sensible time. So it kind of just got to the point where I was like, well, I've been binding for almost 8 years. I need to get surgery and I need to make that happen. In the UK, on average, if you go private for top surgery, it's now over £6,000. Um, and that was really daunting to me. Top surgery in France really ranges in price in a way that it doesn't in some other countries. They range in price, I think, from about €1,500 to about just over €5,000. And there are some clinics that are accessible to English speakers. I think there's one in Toulouse. So I did some research on that. One of my best friends is French and trans. So I ended up going with the surgeon that he had gone to. He was more expensive. His name is André Bouillot. He's based in Lyon. And yeah, he ended up being the surgeon I wanted to go for because I wanted somebody who did, rather than the like lateral incision, did the incision like along the pecs because I'm gay and vain. I wanted to kind of like just run down some of the logistics that I had to think about when making that choice. That's obviously not going to be viable or comfortable or safe for everyone. But yeah, I wanted to, I guess, just touch on some of the things I had to think about. First thing was obviously expenses. A lot of people, especially in the US, have to deal with this because they have to travel long distances to access a surgeon. I had to think about travel for not just surgery, but also consultation. The next is kind of general support, especially from if you're going to a country where you aren't a native speaker. Where are you going to get your sort of information from about the medical system, and who are you going to go to if you have questions? I was very lucky in that one of my best friends works for a trans organization in France, so he was able to, give me a lot of information about how the medical system works. He was able to help me out with some of the like admin and technical details, because I do speak some French, but with something like that, obviously I wanted to make sure I was getting all of the exact details and not like 70 or 80% of the conversation. I would recommend contacting a trans organization if you get surgery in a different country. I would say a trans organization over, say, your surgeon because trans organizations will know the healthcare system best, and may be able to, provide you with like an advocate or somebody who can come and check on you, um, and, or help you communicate with a doctor. Another thing was Postop Care. Again, I had friends there who were able to look after me. I also had to think about where I was going to go for like getting my dressings changed. I recovered in Paris. It was so difficult. Rather than Lyon, where I got my surgery. So I had to find a nurse's practice that I was able to communicate with to kind of sort out, like getting my dressings changed, getting things checked, making sure everything was healing normally. The other thing is admin stuff. Traveling out of the country is not viable for a lot of trans people because we don't have updated passports or visas. Different countries are going to have different standards in terms of accessing surgery. So in France, if you don't have your gender marker or name changed, that often makes it a lot trickier to get surgery. So I did have a piece of ID in my passport where I had changed those things, and I was able to, give them that. That isn't so much a requirement in the UK. Yeah, that was something I hadn't thought about as much. The other thing is surgery prep. I obviously wasn't able to do, a lot of prep like in close consultation with my surgeon. So I had to see an anesthetist and get blood work done. But again, because there are different medical systems, there was some blood work I wasn't able to get on the NHS without like paying. So I ended up having to get that done in France before the surgery. In summary, like a lot more legwork. It's definitely harder to access straightforward care or like, examples of that care on YouTube or Reddit or whatever. And as a trans person, I think that can be quite daunting. I was very lucky with this in that I had, friends in France who've gone through this before who could help me. That said, I think this was a really good option for me. And I would encourage people to look into it if you're looking for a cheaper option going private. If you have any questions, I've dropped some links below and you can ask me anything about my surgery or recovery. So I'll probably do some more videos here, I don't know, at some point, but life is good, recovery's good,